Boleh binaka again Fiji. Our daily case update has been finalized for today. As expected, we have another increase in the daily case total. As of 8 a.m. this morning, 308 new cases of COVID-19 have been confirmed. 297 cases are from the Lami Nosori containment zone. 11 are from the tramline Nandi. 218 of the cases in the Lami Nosori, Suva Nosori are from existing areas of interest. This includes 153 cases from Gauya in Lami. 12 cases are from new areas of interest, and they include Goodman Fielder, Gander Shipping, Nosori Police Barracks, and St. Giles Hospital. The remaining cases are context of known cases or cases that were seen in screening clinics and were swabbed. A full breakdown of is being published online as we speak. The distribution of the new cases can be seen on the map provided on the Ministry's COVID-19 dashboard. Please note that in the interest of safeguarding patient privacy, the locations of cases on the map only indicate the general area a case comes from, and it's not exact. The Gander shipping crew have been isolated. In accordance with our shipping crew protocol, any unloading of freight takes place in areas that are clearly demarcated, so that there are no interactions between crew and others, including people on the ground in Vanuatu and the outer islands. Crew were not permitted to disembark in Vanuatu nor in the islands, and these protocols have been and will continue to be strictly enforced by the police, my medical teams, and the Maritime Safety Authority of Fiji. Be assured that we have not yet facilitated movement of anyone from Vitilevu to Vanuatu or the outer islands. We have specific details on these cases in tomorrow's daily update. A patient who tested positive for COVID-19 has died. This is a 63-year-old male who presented to the FEMAT hospital on the 22nd of June, tested positive, and was referred to CWM hospital. This death is being investigated by doctors at CWM hospital to determine if it was a COVID death or not. There are currently 7 severe cases of COVID-19 admitted at CWM hospital. 2 of the 9 cases in severe condition reported yesterday are doing better and are no longer classified as severe. The metrics that my team uses to assess on a regular basis all indicate that we will see higher increases in daily case numbers in the near term. I want to make sure we understand how that impacts our response and recommendations to government. First, I believe some of us, including those in the media, need a better grasp of what we mean when we say lockdown in Fiji. We are not in Australia, and we are not in New Zealand. In Fiji, a lockdown means 24-hour curfew. It means no movement for any purpose except for medical emergency. No shopping, no going out to get food, no going for a walk, no nothing. It means total lockdown. Other countries have not done that. Australia and New Zealand have not done that. So to say that many other countries have done a strict lockdown is not correct for us. Few, if any, countries have locked down in the same manner that Fiji had lockdown for the initial phase of our lockdown period. Here we have a different system, and the word lockdown signals a much stricter policy. Instead of going for that strict lockdown option, Movement in Fiji has been restricted for essential purposes, and a curfew takes place from 6 p.m. until 4 a.m. every day. Anywhere in the world, that alone would constitute a lockdown. And in many other places in the world, measures similar to these have worked well to reduce the spread of the virus. Why has it not worked in Fiji? 2 words: public compliance. We have not advised the government to enforce a 24-hour curfew for 28 days for Viti Levu. If I believe there was a medical case to be made for a 24-hour curfew for 28 days for all of Viti Levu, I'd advise the Prime Minister directly. I have his number, and he sits across me in most of our briefings. I have not done that because medically, we do not believe a 24-hour curfew for 28 straight days would work. So I hope that puts a definitive end to the social media speculation. If you have time to tweet or post on Facebook, don't dedicate your platform to disinformation. Please emphasize the importance of our health measures, the measures that are proven to stop the spread of the virus. The reason we have not recommended 4 weeks of 24-hour curfew is that given the track record of poor public compliance, we cannot guarantee that we will see the compliance everywhere in the country, and therefore we simply do not have the capacity to enforce such a strict lockdown everywhere in Viti Levu. The tragic reality is that Fijians living in communities most vulnerable to the virus, including those in informal settlements, are also those most vulnerable to the socio-economic catastrophe that a 24-hour lockdown for 28 days would bring about. Even under such a strict lockdown, we believe that the virus would continue to circulate in many of these communities. We believe individuals would attempt to leave these communities, and some would succeed. We believe that a 28 days of 24-hour curfew and the untold hardship it will bring to Fiji, for Fijians, we will still see new cases after 29 days. There are no easy choices at this stage, but we know that some choices are still smarter than others. So we believe that there is a better and smarter way forward than a 28-day total lockdown. Instead, we are dedicating personnel where the risks are greatest. We are allowing for some essential movement so people can get food, get medicine, and go to work as long as they wear masks, they keep a safe distance from others, and make sure they have the Care Fiji app switched on. If that freedom is abused, the virus will spread. If the rules are respected, we believe transmission can be reduced dramatically. Respect the rules, we win. Ignore them, and we all lose, big time. There is a young woman in the ICU right now who's suffering from a severe case of COVID-19. She's 30 years old, and she has no pre-existing medical conditions. The point we want to make is don't think that being young makes you immune. The highly contagious Delta variant present in Fiji has been described as the fittest and the fastest variant in the world. Don't trifle with it. Anyone can be seriously impacted by this virus and this variant. If you won't respect these rules for yourself, please do it for the most vulnerable. One thing that deeply concerns me and my team is the high rate of Fijians living with NCDs. These medical conditions, like diabetes and hypertension, they contribute to the highest rates of mortality from COVID-19. Many of these Fijians are among the first that will be vaccinated, but until all these Fijians are fully vaccinated, we have to take extreme precautions to protect them, especially those living within areas of concern. To make sure these Fijians continue to access life-sustaining medication, We've established a telehealth for Fijians living with non-communicable diseases that will open for the Western and the Central Division from next Monday and be available Monday through Friday from 9 a.m. until 4 p.m. The number is 165. If you need access to your NCD treatment medications, please call us from Monday next week. We'll arrange for you to be able to pick your medication up from safe points or have them delivered by mobile teams if you are living in an area under targeted containment program. The helpline will be monitored and evaluated for calls received to ensure assistance is completed all the way through to delivery of the medication. I want to make another important point. Wearing a mask is an excellent defense against contracting the virus. But it is not the only protection that matters. Masks on their own can only do so much. They do not make you invincible. They can't protect you well if you're hugging someone or breathing over their shoulder in a line at the supermarket. The same applies to maintaining physical distance. It helps, but it only offers a certain level of protection. But when we follow all these measures together, they work extremely well. When we wear masks, maintain physical distance of 2 meters, make sure to wash our hands often and thoroughly, we dramatically reduce the risk of contracting COVID-19. We should all do all these things whenever we are outside of our homes. If we do, the virus has a much harder time moving, even when we move. As announced earlier today by the Attorney General and the Minister of Economy, we have sought the advice of general practitioners, service of general practitioners, to offer non-COVID health care to patients who usually seek care from the public health care system. Starting on Monday next week, in Nandi, Lautoka and Ba, and the Lamino-Sori corridor, these GPs and their private clinics will be open free of charge to patients who would otherwise have sought care at a public hospital. These GP services include consultations, reviews, referrals, injections, dressings, and other minor treatments, all of which will be available from Monday next week to the public. We'll publish the full details of the doctors and the locations of their clinic on the Fiji government Facebook page tonight. They may be actually uploading already. We are also outsourcing the supply of groceries and household items for Fijians in targeted lockdown zones and under home isolation to 2 supermarkets in Fiji, New World and Shop and Save, which will free up valuable time for my teams to focus on direct medical matters. The full list of items that will be provided will be published on the Fijian government Facebook page as well. Today, our vaccination teams administered the second doses of AstraZeneca vaccine to His Excellency, the President, and the Honorable Prime Minister, both of whom have encouraged every eligible Fijian to follow their lead in protecting themselves from COVID-19. Many others have done the same, and we thank them all. I want to remind everyone receiving their second dose of the vaccine that it takes 2 weeks after the second dose for the full benefits of immunity to set in. We are very fortunate to have these vaccines available and on the way. Our target population for vaccination is just over 586,000 adults. And we are aiming to vaccinate as many of these Fijians as possible, as quickly as possible, as these vaccines arrive. When we have achieved adequate levels of immunity, we can begin relaxing restrictions and allow for the possibility of international travel to Fiji. Until that day, we must practice strict adherence to the health measures for mask wearing, hand washing, and physical distancing. In fact, many of the adjustments we're making now will always be with us. This pandemic has changed the world. It will change Fiji as well. Being left behind from these changes means leaving ourselves vulnerable, and we cannot allow that. We have vaccinated 299,202 individuals with at least 1 dose, and that represents about 45% of our target population. Of that number, 32,766 individuals have been fully vaccinated. And in the last 3 days, we deployed 14,730 doses. The Rewa Nursery Medical Subdivision and the Ba Medical Subdivision are now leading the way in terms of vaccination coverage, with 70 and 81% of their target population having received at least one dose of the vaccine respectively. I'm extremely proud of the medical teams and the community at large for achieving these higher coverage rates. But our work is not done. Our mission is to fully vaccinate every eligible Fijian. There are people in intensive care as I speak due to COVID-19. And our doctors and our nurses are going to every possible length to take care of them. The more vaccines we administer, the more Fijians we keep out of ICUs and in the arms of the families that love them. Morally, medically, vaccines are the right choice for all of us. We currently have at least 100,000 doses for ongoing deployment, and there are more vaccines coming in. One day, and one dose at a time, we will be offering protection, and they will be provided to every corner of Fiji. Thank you. I'll now turn it over to Dr. Alicia.
Thank you and good evening. As announced by the Permanent Secretary just now, we've had 308 new cases in the 24-hour period that ended at 8 a.m. this morning. This is another daily record of cases, breaking the previous record that was just set yesterday. As the PS mentioned, 297 cases are from the Lami Nosori containment zone and 11 are from tramline Nandi. The full list of areas of interest are being published on the Ministry of Health's website, as well as the Ministry of Health's dashboard and the Fijian government Facebook page. We also have one death, and this is a person who tested positive for COVID-19, but the death is being investigated by doctors at CWM Hospital to determine if it was caused by COVID-19. There have now been 13 deaths due to COVID-19 in total recorded in Fiji, with 11 of these deaths during the outbreak that just started in April this year. One death, as I mentioned, is currently under investigation. There have been 17 recoveries reported in the last 24 hours, which means there are now 2,173 active cases in isolation. There have been 2,778 cases since the outbreak that started in April. And in total, Fiji has recorded 2,848 cases since our first case was reported in March of 2020. And we've had a total of 653 recoveries. In terms of testing, since the outbreak started in April of this year, we've tested 138,443 samples for COVID-19. And since testing began in early 2020, we've tested 181,294 samples. For June the 22nd, we tested 2,913 samples, and our national 7-day daily average testing is at 2,896 tests a day, which equals to 3.3 tests per 1,000 population. So still a high level of testing. However, our national 7-day average daily test positivity continues to increase as it has done in the last few weeks, and it is now at 5.7%. As Dr. Fong mentioned, now 45% of adults in Fiji have received the first dose of the COVID-19 vaccine, and 5.6% have received the second dose. Looking at the epidemic and what we should expect, our 7-day average of new cases per day has now increased to 189 cases per day, or 214 cases per million population per day. Our daily testing numbers remain at a high level, and yet our test positivity continues to increase. What does this all mean? What does this all mean for you sitting at home? Well, the evidence is that there's widespread community transmission in the Lami Suvarnostori containment zone. This means that anybody you meet outside your home is potentially a case of COVID-19. There are also clusters in Naitasiri and one cluster in Korovo. There continue to be cases reported from Nandi, but they're from within the containment zones. As mentioned before, 2 cases from one family were detected in Lotoka 2 days ago. To date, this outbreak appears confined to Gavitilevu, with the northern and eastern divisions yet to detect a case. However, we are closely monitoring the recent situation with the inter-island shipping crew that tested positive, and our teams on the ground in the respective areas are responding rapidly. As mentioned, we did hit another record number of cases today. And with increasing cases, as we have mentioned before, we expect increasing severe disease and deaths. And while right now our hospitals are not overwhelmed with severe cases, from what we've seen in other countries, this is a very real possibility. And we are preparing for this. However, we know that the vaccine that we use in Fiji is very effective in preventing severe disease from this virus. The United Kingdom has reported 92% effectiveness in preventing hospitalization using the Oxford AstraZeneca vaccine. If you're watching this right now and you're still unsure about whether you want to get vaccinated, or if you've put off getting the vaccine, please just remember this. You need 2 doses of the vaccine, spaced between 8 to 12 weeks apart, to be considered fully vaccinated. And it isn't until at least 14 days have passed since your 2nd dose that you will have the full protective effect of the vaccine. So please don't wait until it's too late. Please protect yourselves and your loved ones now. But for everyone who has been vaccinated, please also think about this. If our hospitals become overwhelmed with patients with severe COVID-19 disease, we will all be affected, not just those with COVID-19 or their loved ones. If you or a loved one have an accident or come down with another serious illness at the same time that we have a big wave of severe cases, it may be difficult for you to get medical care. We know this because we've seen it happen in other countries that have widespread community transmission and escalating outbreaks. So Dr. Fong has talked about what we are doing to prepare for this scenario, but I'm asking all leaders and anyone who has influence over communities or even your own family members, please do everything you can to encourage them to get vaccinated and follow the personal protective measures that we've always been talking about. Stay home as much as possible. If you have to leave the house, please wear a well-fitted mask. Make sure if you have a smartphone, have your Care Fiji app on. Keep at least 2 meters between yourself and others when you're outside your house. Wash your hands frequently with soap and water or an alcohol-based sanitizer. And very importantly, avoid crowds and avoid crowded places. Thank you.
Bolovinaka. Thank you, PS and Dr. Saukan. Today is day 69 of the current outbreak, and as you have heard, we've recorded a record 308 cases, bringing our total to more than 2,800 cases since March 2020, with 13 recorded deaths from COVID-19 to date. We have positive cases that remain cared for in our isolation facilities. We have 112 individuals in 5 hospital-based isolation facilities, 507 individuals in 11 community isolation facilities, 291 in home isolation facilities, and more than 900 individuals awaiting retrieval into isolation facilities. Our screening and contact tracing work continues. In the last 24 hours, we screened 3,202 individuals and swab 1,073, bring our cumulative total to date to 652,225 individuals screened, with 52,512 individuals swabbed. In terms of health services, as I've stated yesterday, Nandi Hospital is preparing to reopen tomorrow morning at 8 a.m. In fact, the emergency services have started this evening at 8 p.m. and by tomorrow morning, general outpatient services and admissions into Nandi Hospital will commence. CWM Hospital continues as the COVID hospital for the Central Division, with the green part of the hospital and the red zone of the hospital functioning well at the moment. The FEMAT hospital remains operational, with admissions and surgical operations undertaken at the field hospital as well as the MV Waveweti. As stated by PS earlier, we are setting up the telehealth specialist outpatient services in the Central Division, very similar to one that's currently operating in Lautoka in the Western Division. We are setting up a toll-free number, 165, which is currently undergoing testing and finalization and should be fully operational from Monday next week. This is for patients who have chronic diseases who attend specialist outpatient clinics at CWM Hospital, as well as the other hospitals around the Lami, Suva and Nosori area. So patients with diabetes, hypertension, heart diseases, rheumatic heart disease, as well as cancer patients who are treated at home and on regular medication. So all they will have to do, once it's open on Monday, all they'll have to do is call the number if they've missed out on an appointment or having some concerns while they take their treatment at home, and someone will advise them and direct them to where they can obtain further assessment or their medications. Whether you are at home or at the shop or at work, we remind you that you must treat everyone as having the virus and ensure that you are protecting yourselves adequately. As you have heard this evening, we do have a number of our positive cases still cared for at home or awaiting retrieval. So you may be listening in this afternoon and be someone who's looking after one of these patients at home. I'd like to reiterate some of the messages that you would have received from the medical team who are looking after you or after your loved one who's positive with the virus. As I've stated, you may be caring for one with someone who has the virus or live in the home with someone who has the virus this evening. Please note that even in these situations, you can avoid getting the virus by listening carefully and following the health team's instructions to you. If you can isolate the person with the virus in a separate room at your home, that's even better. Minimize close interactions at home with the sick one and ensure that your home is well ventilated and the windows are kept open as safely as possible. Dedicate utensils, beddings, towels for the positive patient, and don't share. And this should be washed daily and regularly. Where appropriate, mask at home. Practice physical distancing of 2 meters. Washing your hands regularly and after interactions with the person who's positive, or handling what the person has touched, and as well as disinfecting frequently touched surfaces. Any waste generated should be packed safely and disposed appropriately. More importantly, make sure that no one comes visiting, no well-wishers, no one. Just let them scream over the fence or through the gate the message of good wishes, but don't let them get into your home. As a caregiver, you must also remember that there are some signs, and the medical team would have told you, to watch out for that may indicate that the disease is worsening. If your family member is having difficulty with breathing, or complains of lightheadedness, or chest pain, or is feeling lethargic, or if it is a child at home who is positive and is not feeding well or breastfeeding well, is acting as if he or she is confused, or having bluish discoloration of the fingers or lips, these are called red flags. And it means that you should, when you identify this in your relative who is positive at home, you should call 158 or call the hospital or the ambulance, because he or she needs further assistance. In addition, you as a carer must also ensure that both you and your patient at home, you can take Panadol for fever and body aches. You must stay well hydrated, eat healthy foods, and rest a lot. In this way, you can protect and care for your family members with the virus, while also protecting you from getting the virus. Minawalew, and good evening.